All right, guys, coming to you live. This is Club and Country with some concerning news. In the 43rd minute of the Denmark versus Finland game, Christian Eriksen received the ball from out of bounds and went down immediately. The staff rushed the field. We saw his wife on the field. We saw the fans turning away. We saw the players crying. It was a terrible scene. We've got news recently that Christian Eriksen is responsive and he is okay. But to shed some light on the whole situation, joining me live right now, I have four-time Emmy Award-winning doctor, Dr. Brian McDonough. Dr. McDonough, how are you?
I'm doing good. This is obviously concerning news. Anytime you see a player or any human being actually in this situation, it causes concern. So certainly from the time you made me aware of this, and I started watching, you have your eyes peeled to the television to see how well and how the person is doing, because you don't see this every day, and it certainly is stressful.
How often do we see situations like these? Can you kind of shed some light? It apparently seems like it could be a heart issue. We don't really know right now. It's too quick to make assumptions. But how often do we see live sporting events get postponed in this way?
Sure. Well, a couple of things, just to update the situation. So those who might just be seeing this, the player, Christian Eriksen, apparently has now been stabilized in a hospital setting, which is the most important thing, because when someone collapses on a field of play, again, you don't usually see it during live events because it often happens in practice settings. In the United States, you see it often in the late summer when, let's say, football training camps, especially in days gone by when it was a lot more aggressive, people get super dehydrated and have those types of issues and collapse. But what you see when something in a young athlete like this occurs, especially in a sport like soccer, you think of two things. You think of, was there head trauma earlier in the event or something that would lead to a concussion, which when you have a concussion, you continue to play the sport, you can collapse, and it can actually be a life-ending collapse, or it's cardiac, and you're thinking about what could happen with an irregular heartbeat. Now, it seems, based on what I was able to see, scrolling back and seeing part of the game, which you can, fortunately, on tape these days, I didn't see the player have head trauma. It seemed like he was just, for at least several minutes before, he was just playing, and there was nothing going on, and there was nothing to indicate he had head trauma earlier in the game. I know you were watching it. But when it's an irregular heartbeat or an arrhythmia or something like that, that can happen fast. That can happen at any time. And obviously, it happens in life, for people who are non-athletes, but sports can add to the release of adrenaline, epinephrine, and those things, which can make things worse.
Now, Christian Eriksen is 29 years old. Obviously, he's a professional footballer. He's been playing for quite some time, not right now. What type of induced stress can that put on the heart or the body, just physically playing year after year since he was probably 3 or 4?
He probably is better off, his heart, from a standpoint of training and conditioning, from doing that. He's better off than just about any of us, because he's always pushing himself and he's used to that. I mean, there's classic stories where sometimes there's a famous basketball player named Pete Maravich, who died in his 40s. And he died actually because he had a heart issue that had been there for years, but because he was such a great athlete and in such great condition, he had built what's called collateral circulation, extra blood vessels to the heart beyond what you would normally have. So he had clogged vessels that would have led to a massive heart attack probably years earlier, but because he was in such great condition, he had extra blood supply through small capillaries to his heart and lived even longer. So sometimes when you see these things, you're seeing something that could have been an inherent problem revealing itself. And again, I don't know if Christian Eriksen has a problem or if there's any medical condition, he's on any medications or anything like that. That obviously is probably what they're looking at right now as they're evaluating him. But when someone collapses on the field, the first thing you think of is something in the heart with an irregular heartbeat or some sort of disturbance in rhythm. And you notice they brought out the defibrillator, which is wonderful that they have those things on site to help out, because years gone by they didn't.
Exactly, and that was the main concern. When I saw the defibrillator come out, I, in some respects, was expecting what could potentially be the worst. Is that kind of the last resort, or is that more or less what they do when someone is non-responsive in this situation or similar situation?
Well, what you do normally in situations, you look at airway, breathing, and cardiac. So it's one of the first things you do is you look at the heart and you say, wait a minute, is there a need? So having that brought out, you want to get to it as soon as you can, if that's a possibility. So the fact that they were out there, I think within a minute and a half, that's actually very good timing,
Sure.
to recognize the issue, address the issue, and get moving with that. That was important. And again, we don't know if it was cardiac, but the fact that they were able to bring that on board was very helpful.
Now, it sounds like he's stabilized at this moment. What is the likelihood that Christian Eriksen could play again? I know it's maybe too early to assume, make assumptions. That's not right. But do players typically come back from situations like this?
Well, right now, obviously the big thing is to get him out of the present situation, to make sure he gets through this and survives. What they need to do is find out why, and that will tell you a lot about it. What is going on there? For instance, does he have an enlargement of the heart? And again, I'm not going to say he does or doesn't, but if he has that, that's a different issue. Then was he taking a certain medication that may have caused problems? They'll certainly test his blood. They'll see where there are any toxins. All of those types of things you evaluate, and you see what's going on, and you see if in fact he's ever had a history of problems. Often we see this for the first time, and it's devastating for families, because you might have a 19-year-old athlete who's training for a sport, or they're in high school and they collapsed on the field, and it's obviously someone in the prime of their life, best condition. You don't anticipate that in young people. I think that's part of what's so startling in an event like this. I mean, you mentioned you were watching, you're a soccer fan. A lot of people, all age groups, are watching. You just don't anticipate someone at the peak part of their life to have an issue. We've seen it with umpires and referees, and even then it's hard, but you understand, well, boy, that person's older, and this is someone who is the peak performer, but it can happen. It's variable.
Especially considering what we've gone through as a global nation this past year, to have soccer back in general in the Euros, it's great. It's a spectacle, and to have a Scandinavian matchup was pretty cool. But that was devastating to see and like this. And take a step back, maybe 10, 15 years ago, when they didn't have defibrillators on the sidelines. When did we start seeing defibrillators? And was it constant occurrences and tragedies that brought them to the sideline of sport today?
Well, the one, again, having done news television for a lot of years in the past, one of the stories I covered was in 1991, a basketball player named Hank Gathers. And those who are older will know it, even if you're a big sports fan, that Hank Gathers played for a college called Loyola Marymount. And he had a heart issue and was told to take a medication called a beta blocker. And a beta blocker slows down the heart, but it was helping his heart issue. But it makes you sluggish. It makes you tired. And so being 18, 19, 20 years old, he didn't really always take his medicine. And he played a game, and without the medication to protect his heart, he collapsed. That being said, had there been the ability to have something right there to cardiovert, could have made a big difference. But it wasn't as available then. Now you see them everywhere. You see them in high schools. You see them in all sporting events. And it is amazing, because it's time that saves lives. You look back and there were players, I mentioned Hank Gathers because I covered the story, but there are players who all sorts of situations would die on the field or whatever, or during training camps or whatever. You would hear it a couple times a year almost. Sure. You don't hear as much now because we have a lot of these treatments.
And that is very true. I even in the NFL over here, I remember a couple players in the past, college football players, dying of dehydration, in similar occurrences here. Now let's talk a little bit about, excuse me here, I'm getting kind of
I know you get updates and reports on the situation as well while you're watching. So
yeah. So let's take a step back and what jumped into your mind first when you saw this right away as a doctor? What's your first response? What are you thinking?
Well, the first response is obviously, like anyone else, shock, and you're concerned for the player's family and the event. But then immediately you go into another gear where you're thinking about, okay, there's medical help there. Are they coming to the person's aid? Good. Thanks goodness they're there. Because then what you're doing is you're putting the person in the best possible situation they can be. They did a really good job of clearing people away. In fact, the players even performed like a circle, but they got people away to give the healthcare providers room to take care of the patient. That's really important. And then you can assess it. And the key is, and these people are trained in sports medicine for these issues, is staying calm in the situation. Like, you can't have the physician coming out and being all emotional, worked up. They have to just almost look at it. In many ways, it's very similar, like an athlete, goalie protecting the net. You go in and you have to stay calm and you have to be at your best in that situation. And I think what it does too, for people watching it, it really shows, the importance that there's all other things more important than sports. How this kind of really puts things in perspective. As fun as sports are, and as important as they are, and how these teams, people will live and die with their team, so to speak. When something really serious happens, you can see how everyone just kind of got together. They got quiet, and they realized what was going on.
Now, let me ask you, Dr. McDonough, you've covered some sporting events in the past. I know you're out at UCLA a while back on the sidelines for the UCLA men's football team. In an event like this, do we typically have the best of the best doctors on the sideline waiting to respond?
What you do is first of all, you have people who now, even when I was doing it in the late 80s, early 90s, there were organizations like the American College of Sports Medicine and others, but they were developing fellowships and extensive training in areas such as sports medicine, and now to the degree where they even break it down by team. So when I was working with UCLA, the head football coach who I was with was a doctor named Jim Puffer, who actually was the head physician for the 1984 Olympics in the past.
Sure.
So he was a gentleman who was training younger doctors in a new field of sports medicine. And what we now have, you think back on that was 30 years ago, you have 30 years of development. So what you now have is you have specialized people. So when you get to a level of an event like that, you're going to have basically people who are trained for all those situations. And you're also going to have a wide variety of people. They literally would have an ophthalmologist there in case there is somebody who had their eye damaged. They will have cardiologists there. They'll have sports medicine. They'll have orthopedics. Everybody is kind of there to help. And some of them might just be in the stands, being there. They're given tickets or a stipend to be there just in case. But they're available if they need to go to the hospital or places like that. And then, of course, they have ambulances and everything on site to take care of that. And when I've worked in situations like steeplechase and others where I've had to be a physician on site, there's a whole backup to you. You're one person, but they know one person isn't going to do much. You just have to kind of be the captain of the ship, so to speak, and then the others will, work with you.
Sure. Dr. McDonough, let's just wrap up with one more question. You kind of alluded to the next steps in diagnosing Christian Eriksen. What can you only imagine that the medical personnel are going through right now? Would he be stabilized at a hospital? What really are the next steps? How long are individuals typically under medical care after similar occurrences?
Well, the first thing is they're going to stabilize him. They want to make sure, and we're getting reports so far so good. So they'll do a battery of tests, and by that means they're going to test his heart. They're going to be obviously looking at blood samples, those sorts of things to see if there's anything that was off. In addition to that, he will be closely monitored. He'll be given IV fluids, those things. Very rarely in these situations would you see somebody just kind of go home because they want to make sure all the tests are in. They may even do some CT studies, for instance, in the brain, other areas, just to see, is there a bleed? Is there something else that got by them that could have occurred? Because remember, the cameras aren't on players all the time. Things happen. It could be a glancing blow. They could head a ball. As we've talked in the past on health issues, soccer is one of those sports where you have repetitive head trauma, just by the nature of the sport. So all those things they'll be looking at, and they'll probably also, with electronic medical records, get access to his other records. And they probably have the team physician as well, who pretty much knows those players, going over those things as well. And I think the other thing you're going to see is time spent with the players and the teams, because they're going to be shook up. And from a psychological standpoint, that it can really impact them. So I'm sure the teams already are talking to the players, talking to the families, because you said he's 29 years old. The older I get, 29 is really young to deal with issues like this. Athletes are not used to, they're used to athletes being superior and immortal. And when something like happens that raises concern, that becomes an issue.
Well, Dr. McDonough, thank you for joining us live today on such a quick notice. I think the information that you've given us really kind of helps us with the current situation in dealing with Christian Eriksen's injury. And I hope that you would join us in the future, hopefully not under these circumstances, but it's been great having you on live today.
It's my pleasure. Keep up the great work.
Thank you, guys. And for anyone watching, this is Club and Country, coverage of all U.S. men's soccer, U.S. men's national team, as well as some Euro soccer coverage. If you enjoyed today's episode and live coverage, please make sure to subscribe. I'll see you soon.